Hello, and welcome to a presentation about Summit Cancer Research funding opportunities through the Department of Defense's peer-reviewed cancer research program. I am Camille Bonta, and I serve as the policy and advocacy consultant for Debbie's Dream Foundation, Curing Summit Cancer, which is pleased to be able to bring this timely webinar to you in partnership with the American Gastroenterological Association. Next slide, please. The objectives of today's webinar are to help researchers recognize the role of the peer-reviewed cancer research program in funding cancer research and to learn about the peer-reviewed cancer research program funding opportunities and strategies for funding success. Next slide. In a moment, you're going to hear from Dr. Donna Kimbark, who is the program manager for the peer-reviewed cancer research program. But first, I want to say a few words about advocacy efforts to ensure continued funding for Summit Cancer Research through this program. Next slide. Next slide. In 2014, Debbie's Dream Foundation approached members of Congress about including Summit Cancer in the peer-reviewed cancer research program. Summit Cancer advocates made the case for Summit Cancer's inclusion, including military relevance and a historic lack of funding for this deadly cancer. That year, Congress included Summit Cancer in the program for the first time. And since then, funding for the program has continued to grow, and Summit Cancer continues to earn its spot in the program through ongoing advocacy. Next slide, please. On February 11th, nearly 125 Summit Cancer advocates participated in roughly 170 virtual meetings with members of Congress and staff. In those meetings, the request was made to include Summit Cancer again in the program for fiscal year 2022. Debbie's Dream Foundation and Summit Cancer Research advocates are fortunate to have three incredible congressional champions. Next slide, please. Congresswoman Lois Frankel, Congressman Adam Kinzinger, and Senator Mazi Hirono. Again, this year, these three lawmakers are championing the continued inclusion of Summit Cancer in the peer-reviewed cancer research program. They are circulating appropriations letters to their House and Senate colleagues, asking for their support. Debbie's Dream Foundation advocates are currently working to generate the signatures of as many congressional lawmakers as possible in an effort to have a strong demonstration of support to appropriators. Next slide. If you would like to learn how to become involved in these advocacy efforts, please contact Nicole Berngard, Events Director for Debbie's Dream Foundation at events@debbiesdream.org. Now it is my pleasure to introduce Dr. Donna Kimbark. Dr. Kimbark received her Ph.D. in molecular pharmacology and cancer therapeutics in 1996 from State University of New York at Buffalo, Roswell Park Cancer Division. Following postdoctoral training at Johns Hopkins University, she worked in the biotechnology sector before joining the congressionally directed medical research programs in 2002 as the science officer for the breast cancer research program. While working in grants management, she received her certificate in epidemiology and biostatistics from Drexel University, and in 2008, Dr. Kimbark became a program manager for the CDMRP. Throughout her years at the CDMRP, Dr. Kimbark has managed research funding programs for autism, multiple sclerosis, cancer, and bone marrow failure syndromes. Currently, she leads the program teams for the peer-reviewed cancer research program and the melanoma research program. In addition to her programmatic duties, Dr. Kimbark also leads the funding opportunities announcement team, where she coordinates the creation, revision, and approvals of the solicitation for grants. Thank you, Dr. Kimbark, for joining us today. I will now turn the presentation over to you.
Thank you for that introduction. I'm making sure that everyone can hear me. Just great. Let me see if I can go to the next slide. Can you go to the next slide? I cannot use the, okay, so let's go to the next slide. That just tells you who I am. I think you already know. So let's talk a little bit about the congressionally directed medical research programs. Some of you might know about us, but others you might go, oh, what's this all new thing about? The congressionally directed medical research programs is part of the Department of Defense. We're part of the Department of the Army, specifically the Army's Future Command, and we actually sit up at Fort Detrick at the Medical Research and Development Command. Let's go to the next slide, please. When we talk about the congressionally directed medical research programs, we often talk about our history, how we came to be under the Department of Defense, and that had to do with cancer advocates, specifically breast cancer advocates, going to the Hill in the early 1990s, asking for more funds to be directly specified for breast cancer. And this brought in, don't go to the next slide, please, go back, please. Thank you. So this brought in a lot of acknowledgement that we needed more work in cancer, specifically selected areas, and CDMRP grew from that. Our vision is to transform healthcare for service members and the American public through innovative and impactful research. Our mission is to responsibly manage this research through that discovers, develops, and delivers healthcare solutions for service members, veterans, and the American public. How do we do this? We do this by funding groundbreaking, high-impact research where we bring all of our stakeholders together, including scientists, clinicians, and patient advocates, people who have had the disease. And we think it's important that everyone has a voice at the table. Let's go to the next slide. Really, what you're really here for is for the peer review cancer research program. So I'm going to really dive into this right away. Usually I have a bunch of preliminary slides that I'm going to talk about the CDMRP, but really, you're really here for the PRCRP. So let's talk about that. PRCRP started in fiscal year 09 with an appropriation of $16 million. As you can see, we've grown exponentially over the years. The number of topic areas has changed. It's not actually connected to how much money we get. So you can see that orange line goes up and down. How the topic areas are selected, I think it's great that Camille brought up the idea of how they are selected. It's dependent on, the stakeholders of Congress, congressmen and women, talking to advocates and making that decision to include it in the peer review cancer research program. That has nothing to do with me. I am not allowed to advocate for these different topic areas. It would be an ethical violation. Our vision for the PRCRP is to advance mission readiness of those in the military affected by cancer and to improve their quality of life by decreasing the burden of cancer on service members, their families, and the American public. Our mission is to specifically to successfully promote high-impact research for cancer prevention, detection, treatment, quality of life, and survivorship. And I'm going to go through how we do all that. Now, the congressional language for the peer review cancer research program tells us what our appropriation is, but it also tells us other things that are really important. I'm going to go into that in depth. Let's go to the next slide. When we go to the next slide, you can see our fiscal year 21 topic areas. We have 20 topic areas this year. That includes stomach cancer. It also includes some new cancers as well. You can see those listed in the green. But stomach cancer has been with us since fiscal year 15. For fiscal year 21, we have our highest appropriation yet, $115 million. 20 topic areas with 6 new topic areas. I want to make a point that we have prohibited cancers as well. Not only what cancers are allowed, but what cancers are prohibited. Prohibited includes breast, pancreatic, prostate, ovarian, kidney, lung, melanoma, and rare cancers. Now, people stop with when I say those rare cancers. Why rare cancers? Stomach cancer can be considered a rare cancer in the United States. Well, we do have congressional language to cover that as well. The inclusion of the individual rare cancer research program shall not prohibit the peer-reviewed cancer research program from funding the above-mentioned cancers on the left-hand side of that slide that may be rare by definition. That means that we can fund stomach cancers. And the relevance to service members and their families is required according to congressional language. So don't worry about the rare cancers being included in there. All those prohibited cancers are what we really pay attention to. Let's go to the next slide. Now let's talk a little bit about that link to military health. A lot of people get put off a little bit by the idea that they have to do relevance to military health focus areas. They're required for all of our funding opportunities, but how do you handle it? You handle it by, there's two different military health focus areas, environmental or environmental exposures or risk factors that may be associated with cancer. This includes ionizing radiation, chemicals, infectious disease, and environmental carcinogens, for example. There are all kinds of different ways to use this environmental risk factor associated with cancer. H. pylori is one of those that might be a risk factor for stomach cancer, for instance. Now, mission readiness is also important. These are gaps in what I like to call the cancer care spectrum, from prevention, early detection and diagnosis, prognosis, treatment, quality of life, and survivorship. It may affect mission readiness of the service member. This is important when we think about it. When we think about it for mission readiness for the service member, if the service member's family member, spouse is ill with stomach cancer, their service member will not be fit for duty. They will not be ready for duty, I should say. They will not be ready for duty because they will probably be asked for exceptional service where they won't be deployed. So they can go with their family member and go to the appointments that they need, or be their caretaker, their main caretaker. Even if the service member is diagnosed with stomach cancer, then they will not be mission ready either, because they will have to be under medical care. So I'd like you to go to the PRCRP webpage on the CDMRP webpage and look for the YouTube video that really talks about mission readiness and how we look at our vision of military health focus areas. Let's go to the next slide. Now, this is a slide that has a lot on it, and I'm going to tell you once again, you can go to the PRCRP page on the CDMRP webpage, and you can see these all listed here. These are our new overarching challenges, and what we're trying to get at here is really a strategic plan. How do we attack cancer, and how do we attack it well? There are several different ways to do this. First of all, we want to develop strategies and biomarkers to predict cancer risk, treatment resistance, recurrence, and advanced disease, improve prevention strategies, diagnosis, treatment, and outcomes for patients in underserved or under-recognized populations, such as military populations, rural populations, communities of color, other minorities, and women. As you can see, I'm not going to go through all of these. I'm going to really strongly urge you to go to the website, or when our program announcements are released next week, they will be listed in our program announcements as well. So it goes all the way from prevention all the way to survivorship. We're really trying to cover all of the bases here, but with some fine tuning. Not just say, oh, we want prevention studies. We're going to talk to you and tell you the types of prevention studies that would be best. Now, if your interest is not in this list, you're not out of the game yet. One of the things that we have said is that alternatively, if your area of expertise and your area of your study is not in here, just go ahead and give us a justification as to why it's one of the important challenges in stomach cancer these days. So that's one of the ways that you can actually do something that might not fit in these overarching challenges. Let's go to the next slide. Now I'm going to talk to you a little bit about the history of stomach cancer in the PRCRP. First of all, just to give you some orientation of stomach cancer in the DoD and veterans. Among veterans, the prevalence of active H. pylori remains high at nearly 30%. It's really high for a population, especially a population in the developed world. The WHO classifies H. pylori as a class 1 carcinogen, and over 25,000 cases are diagnosed of stomach cancer in the U.S. per year. Now, stomach cancer, as I said, was designated as a PRCRP topic area for the first time in FY15. From FY15 to FY19, we've funded $22 million in stomach cancer with 43 awards. In FY20, we just finished funding our awards, and we have $4.6 million to add to that 22, and that's 6 awards. And I do want to tell you that for the stomach cancer receipt, that was about 27% funded funding rate. Now, the types of stomach cancers that we usually focus down on are really those adenocarcinomas and gastrointestinal stromal cells, although some people may come in with other types of stomach cancer, but mostly we're really looking at the top ones there. I did want to show you some of the types of cancers grants that we've done before. There's a couple of them written out here. We've done some big data screening out of MD Anderson to look for novel targets to do for stomach cancer. For stomach cancer. And this is by Akbani at the MD Anderson. Also, we've done with Douglas Scott Morrell at the University Services Uniform Services University. We've done some studies in the understanding molecular H. pylori induced massive inflammatory response. We're really looking to see how that affects DNA double strand breaks, because it might not always be about mutagenesis of DNA by H. pylori, but that massive inflammatory response that occurs. And also we've funded Dr. Lee out of MD Anderson again, who aims to uncover predictive markers that can identify patients with high risk of recurrence. Really important here. We need to know high risk of recurrence. This is one of the things I've seen over and over again with close friends of mine who have had cancer, is that they get through that first stretch of chemotherapy and their surgeries and so on, and they're disease-free, and then suddenly the recurrence occurs, and then their battle is that much more difficult. So Dr. Lee out of MD Anderson is really looking for some high-risk patients and what those markers might be. So let's go to the next slide. So today what I'm going to talk to you about now is I'm going to talk to you about some tips and some strategies to get through this process. At first, our programmatic cycle is shown here, but really what you're going to really focus down on is those funding opportunities are going to be released. We're hoping to release them next week. Okay, so you're going to be set and ready to go. So you're going to have to apply through a pre-application process. I'm going to discuss with you the different types of pre-application processes. There are 2 different types. You're going to have to know how to deal with those 2 different types. Now, I'm also going to then go into the full application, what to look for in the full application, and then also some really clear ideas of how to write that application and get through that peer review process and what the programmatic review process is. So let's go to the next slide. Okay, so how do we find the funding opportunities? Because that's the first thing you're going to want to do next week. You're going to want to go, you can go to our website, cdmrp.army.mil, or go to your very favorite web browser and just put in CDMRP. You should be able to find it. Or you can go to eBRAP, which is our portal, for receipt for pre-applications and other things that you'll need to know, your forms and other things like that. Or you can go to grants.gov and put in our number, our CFDA number, which is 12.420. Any of those will bring up the funding opportunities. So let's go to the next slide. When we go to the next slide, let's talk about how to submit, because that's something that I need to know, okay? You're going to submit your pre-application first. Everyone needs to submit a pre-application. There's no getting around it. Now, there's two different types of pre-applications, a pre-proposal or a letter of intent. I'm going to talk about both of these. But it's important to understand that you're going to submit your pre-proposals via eBRAP, but your full application is going to be submitted through grants.gov. Let's go to the next slide. Okay, so pre-proposal, letter of intent. What is the difference? So let's talk about the difference. So pre-proposal, you're going to have to spend a little bit more time on. This is submitted through eBRAP. Follow all the instructions. The instructions specifically in the general application instructions tells you to what buttons to actually press. So pay attention. You're going to do a pre-application of a two-page narrative for both the IDEA award and the impact award. Now, if you've applied before, you might notice that the IDEA award has gone from one-page narrative to a two-page narrative. The reason why we did this was because we have added in those overarching challenges, and we want you to spend some time talking about how you're going to address them. The pre-proposal may also include bio sketches and other supporting data, depending on what you're submitting for, either the IDEA or the impact award. An invitation to submit the full application is required for this type of award mechanism, like the IDEA award and the impact award. Now, the letter of intent. Letter of intent is different in that you're still going to submit through eBRAP, but that letter is going to state your intent to apply. I'm going to apply. I'm going to have a proposal in stomach cancer. Period. You don't really have to say anything else. No one is going to review this. We use it for administrative purposes only, okay? You do not need an invitation to submit a full application with a letter of intent. So there's a couple of different award mechanisms that I'm going to talk about: the Behavioral Health Science Award, the Translational Team Science Award, and the Career Development Award. They do not require an invitation to submit. They only require a letter of intent. Let's go to the next slide so that we can discuss that. Okay, so let's talk about those funding opportunities. Really important to do what these funding opportunities are all about. The IDEA Award, all researchers with a faculty level appointment are eligible. This supports innovative, high-risk, high-gain research. What the emphasis here is on innovation, okay? What is innovative in your life? For me, this sounds crazy, but it was innovative when I got my little iRobot vacuum, okay? Because now I don't have to vacuum every single day. I have 3 dogs, 3 cats, and a bunny. You can imagine how hairy my house is. This was an innovation for me. It changed my life. So think about out-of-the-box ideas. This is not an avenue of research that you have in your lab right now. You might be studying stomach cancer, but this is something new, something that idea. You want that seed money. You want that seed money to start up an idea. It's something that you cannot get funded with an R01. Preliminary data is not required, and the direct costs are $500K for up to 3 years. Now, key points for success. With your innovation, argue your case. Justify why it's innovative. Innovation is not the next incremental advance. It's not the next logical step of your research. You're not just changing one cancer to the other. I've actually seen where somebody has copied and pasted, done the search and destroy and put in stomach cancer, and then suddenly they missed one of the breast cancers, and that's the problem because that's not innovative. Preliminary data, if you submit preliminary data, it will be evaluated. So make sure that whatever you submit should be minimal, but if you do submit it, make sure it strongly justifies your case. Pay attention to the newly minted FY21 overarching challenges and the impact statement, and don't phone in the military health focus areas. Go to our website, go to the PRCRP website, and look at all the information we have there for you to address the military health focus areas. Go to the next slide, please. When we go to the next slide, we're talking about the impact award. So the idea award that I just talked about and the impact award, both of these are the two that are important. You have to do a pre-proposal, a 2-page pre-proposal before you can get invited to do the full application. Now, the impact award is an assistant professor or above are eligible. Here, you really want a near impact. What the impact award is supposed to be about is you're trying to translate what the preliminary data that you might have generated with an idea award before. You're trying to move it to the next phase. So here we're trying to see the next phase. You're doing a near term on an area of paramount importance in cancer, and you're showing how you're going to go to the next phase. Clinical trial support is allowed. Preliminary data, of course, is required. Here, the direct costs are $1.25 million over 3 years. So it's a little bit higher than it's been in the past. The impact should be clearly stated how it is near term. You don't have to be right at the point where you're going to give it to patients, but you have to explain and justify why it's near term, and justify how it's an advance in one of the overarching challenges. And let's talk about the continuity of research. We have what's called a research outcomes plan that you have to answer to. And a lot of times people don't really know how to deal with the research outcomes plan. And what I like to do is tell people, okay, before you write your research outcomes plan, I want you to sit down and I want you to do an Einstein thought experiment where you're thinking about what the possible outcomes are of your research. After you have those possible outcomes, the next thing you're going to do is you're going to jot those down and then figure out what's going to go next and what's going to go next and what you need to get there. Okay, so write out a Gantt chart and figure out what you need to get there. And then go to the research outcomes plan and use that as your building blocks in order to write what you need to do here. Why is this research distinct, and how should you get funding for the next step, and what are your future plans? So this Einstein thought experiment will really help you in your research outcomes plan. Let's go to the next slide. Translational Team Science Award. Now we're in the award mechanisms that you do not have to do a pre-application for, a pre-proposal for, only a letter of intent. Here, the Team Science, this is the Team Science Award, so we're going to have multiple PIs working together, and they're at assistant professor or above are eligible. 2 to 3 PIs are going to partner together. We're going to have an initiating PI and then some partners. And this is going to support hypothesis-driven correlative studies associated with an ongoing or completed clinical trial. This is important. We want a hypothesis-driven study. This is not something that's exploratory by nature or anything like that. What we're trying to do is we're trying to take what you get from clinical trials, bring it back to the bench, and then reinform the clinics. So that's what you're trying to do here. It's a synergistic back and forth here. All of the partners should have an intellectual stake of this work. Clinical trial support is allowed. Preliminary data, of course, is required. And the direct costs, can you go back to the Translational Team Science Award, please? We're going the wrong way. Excuse me. Yes. Yep, there you go. The direct costs have gone up this year to $2.5 million amongst the partners over 4 years. So your key points for success are really to show how this collaboration is necessary and important to the work. The translation, the bench should inform the clinic. It's not just going back to the bench. It is informing the clinics. Also, once again, you're going to You're going to justify your overarching challenge and how it works here for stomach cancer. And then the research outcomes plan, do that Einstein thought experiment again and work on it, okay? So let's go to the next slide. The Behavioral Health Science Award is an award mechanism we only started off in FY20, so I really want to push it because it's really important. It's one of those ones that people don't really think about when they think about cancer research. They don't really think about it. Oh, yes, the patient has been treated. Now go along with your life. That's not how we should be doing science. We should be doing science so that we make an impact on that patient's life, and we make sure that that patient's life continues successfully. So we're looking for independent researchers with faculty level appointments. We're looking for some behavioral health science research that's innovative. We want to pay attention to those 3 stages of survivorship, and I'll talk about those in a minute. We're looking for survivorship, quality of life, psychosocial effects related to cancer, neurocognitive issues, and so on. This does allow for a pilot clinical trial, but there are only 3 overarching challenges that are included from the PRCRP overarching challenges. Take a look at them there in the actual program announcement when it's released next week. The preliminary data is required for applications that are proposing a clinical trial. $1 million over 4 years. Now, really, the success points here are the impact is to change the lives of patients with cancer. It's beyond only treatment. This is not science for science, for the sake of science. This is science for the sake of people. A patient advocate must be included. It should be from the cancer being studied. One of the big faults that I saw in applications last year was the patient advocate was not from the cancer being studied. So we should have a stomach cancer patient advocate, not just someone from like breast cancer. Once again, you want to justify those overarching challenges and how it fits into stomach cancer. And then let's talk about the 3 stages of survivorship that you should focus in on. Survivorship is acute, extended, or permanent. Acute is the diagnosis through the end of the initial treatment. Extended is survivorship from the initial treatment to the months after, and then permanent is survivorship as the years pass after treatment. Long-term effects of cancer and the treatment are the focus here. So let's go to the next slide. Can you go back one? Okay, go to the next slide. Okay, there is one other funding opportunity that was not included in this slide deck, I'm sorry to say, but it is the Career Development Award, and I think it's really important for you to take a look at that one too, especially if you're within 7 years of your terminal degree. There's not much changed from last year, so please go ahead and look at that on the website. So I wanted to tell you how to go through and look at the documents that you would pull up from our website or pull up from, for instance, grants.gov and so on. So let's take a look at them. You have a program announcement and the general application instructions. What you want to look at in the program announcements, you want to read the whole thing. I expect that you probably will skim some of it, but you should read the whole thing. But what's important on the front cover is the actual dates that are important for you, that give you the deadline dates and so on that you should be paying attention to. The general application instructions gives you the step-by-step information that you have to include. These are really important, for instance, for your project narrative, for your budget, and so on. So take a look at the general application instructions. Really gives you a point-by-point discussion and directions. Let's go to the next slide. The first tier of review. Okay, so say you've put together your application and you think you're ready to submit it. Have you actually gone and looked at the peer review criteria? Because one of the things you have to do, say for instance, you're watching the Winter Olympics and you happen to watch the ice skaters. Are the ice skaters playing to the crowd, or are they actually playing to the judges? They're playing to the judges. Of course, they're skating to the judges all the time. So here at peer review, with your applications, you have to play to the judges, okay? And the peer reviewers are evaluating your work. They're going to look at your technical merit. They're going to do a criteria-based evaluation of the entire application. So it's important that you understand what those criteria are. Now, how the peer reviewers are, who the peer reviewers are, we don't allow identities to be known to the applicants, and contact between the reviewers and the applicants is not permitted. But you can be assured that the panel is comprised of scientific, scientists, clinicians, consumer advocates. There's no standing panels, and the reviewers are recruited based on their expertise. So we do pick the experts for our panel. Also important to note is that when you're going to select your topic area, say you're looking at metastatic stomach cancer, and you see metastatic cancers from there, so you decide you're going to click on metastatic cancer. It would be better to click on stomach cancers, so you get on the stomach cancer peer review panel. So the outcome of peer review is a summary statement. But before I go into that outcome, let's talk about the peer review itself. Let's still go into the next slide. When we go to the next slide, this is an example of peer review criteria, what you would find under the peer review criteria for research strategy and feasibility. Every single one of these points should be something that you paid attention to in your project narrative, for example. You have to make sure that you're playing to the judges, and the judges are the peer reviewers. They're evaluating these on each one of these criteria. They focus down on those criteria. So they're going to answer, they're going to have somewhere on their portal that they're doing the evaluation, they're answering each one of these. And if you didn't answer one of those, that's a demerit, okay? Let's just call it a demerit. It's a weakness, right? They're going to put it under weaknesses then. You're opening the door for weaknesses. So make sure that you answer all of the questions that the peer reviewers evaluate. Let's go to the next slide. So after the peer reviewers are done, the summary statement then goes to the programmatic reviewers. And in the summary statement, we have strengths and weaknesses. If you left the door open, they're going to put some weaknesses in there. If you didn't, they're going to have a nice long list of strengths. And if you're really good about how you write this, they're going to have, you're going to get strong scientific merit. They're going to be looking for a comparison-based evaluation at this phase. At peer review, they don't compare and contrast the different applications, but at programmatic review, this is where they do that. They do the portfolio analysis. They look for what is the best of the best in each one of the topic areas in order to fund appropriately. The programmatic panel members are the people that will give us our funding recommendations. Go to the next slide, please. The next slide here shows you a list of our programmatic panel members. You might note that Ken Tanabe is on here and Lopra Mishra are on here. Both are stomach and liver cancer gastroenterologists. So they are very important for you to keep in mind not to include, do not include them on your application, because that's considered a conflict of interest. And a conflict of interest means that your application gets booted. You don't go any further. So that's really important to go over this. It's important to look at each peer review criteria for each one of the different mechanisms, because it does change. And what the note here I say that don't phone it in is that military health focus area. If I have 2 stomach cancer applications and one has spent a little bit of time and a little bit of energy writing a nice military health focus area statement, then that one is probably going to be funded over the one that phoned it in. You don't necessarily have to do reach out to VA or reach to the DOD to get soldiers on your clinical trial, for instance. But you have to acknowledge the military health benefit here. Let's go to the next slide. These are important strategies for success. Number one, pay attention to the deadline. It's really important for you to pay attention to the deadlines. If something comes in after the deadline, I cannot let you in. There's no way. Don't ask it. Coordinate your effort. Bring your team together early and start talking early. And that includes your business official. Your business official is part of your team. So bring everyone together and start working together. Grantsmanship. I like to call this the TED Talk. State your idea up front and then back it up. Okay? Don't, drift away and not get to the idea and not get to the point of your proposal. Use a clear voice. Forget the jargon. It's not a competition to see how many abbreviations are included. The DoD already won that competition. There's no reason for you to try. Review your documents prior to submission and use the verification period. We have a submission deadline date. You submit it to grants.gov. And then there is about a 5 to 7 day window that you can go on eBrap and take a look at your application and make sure everything is copacetic and make sure that you have everything where you need it to be. For instance, maybe you have a partner and your partner overwrote your biosketch. Now you have a problem. You can resubmit that biosketch. You can upload it into eBrap. The only things you cannot upload or change are your project narrative and your budget. Everything else can be moved around within that 5 to 7 day period. Again, what's the intent? How do you fit in? It's the TED Talk again. Make sure that the intent of the mechanism and what you're trying to do fit together, okay? If you're doing something really, really preliminary, you don't fit in the impact award. You fit in the idea award. Impact is so important because this is for patient's sake. This cool science is great. It's wonderful. But the impactful science is outstanding. Show how it's important and impactful to patients. And once again, feasibility. Define your team's skills. If one of your team members is really a great biostatistician, define that, explain it, put it where it's seen so that people don't say, oh, they just phoned it in as far as statistics are concerned. Outline your justification on how and why you can achieve the anticipated outcomes. So really plan. Let's go to the next slide. Some pitfalls. I've already mentioned, do not include the panel members, the programmatic panel members. Do not exceed the page limit. When you convert into a PDF, make sure it hasn't gone over. There's nothing I can do if it's gone over and you've exceeded the page limits. Do not miss the submission deadline. Remember, grants.gov validation can take up to 72 hours. We don't control grants.gov. Grants.gov controls grants.gov, so you need to make sure that you give yourself a good window of that validation, okay? Validation and the verification period overlap. So there's a possibility that you submit to grants.gov. It could take up to 3 days to get it validated and for us to pull it down into eBrap so you can look at the verification. That means that 3 days of your verification period has been used up by grants.gov. System-to-system submissions are sometimes problematic, so pay attention to that. And remember that you cannot resubmit your project narrative or your budget during the verification period. Let's go to the next slide, please. Okay, so these are your timelines. These are on the front page of your the program announcements. Very easy. You don't have to memorize them now because they will be published next week. Go to the next slide. For more information, please visit our webpage at cdmrp.army.mil/PRCRP. There are overviews of CDMRP videos and also webinar series videos that are important for you to take a look at. They'll give you much more in-depth information on successes and pitfalls that you might encounter during applications writing and creation. And I think that's my last slide. Thank you.
Thank you so much, Donna. That was an excellent presentation and very comprehensive. I believe we are going to open this up for a few questions, and while they come through either, I think through our chat box, I'm going to kick it off with a question about the Behavioral Health Award. And you mentioned that the application does have to include a patient advocate that is specific to the cancer for which the proposal is being based on. What is the best way to hook up researchers who may not necessarily know who to approach for that? I mean, clearly they can come to Debbie's Dream Foundation, but do you do any work in helping link researchers together when they may have a really great idea, but they just don't have a patient advocate to fold into their application?
Usually I do not do that. If anyone does come to me and asks me what to do, I usually give them Debbie's Dream Foundation contact information. That's what I do.
Okay, great. Thank you. Nicole, are there any questions that are coming up?
At this moment, we actually do not have any questions that have been asked at the moment.
Thanks, Nicole. Now, Nicole, this webinar is being recorded and it will be sent out and links available to either people who missed it or those who are on this presentation who may want to review it again, correct?
Yes, that is correct. And it will also live within the Debbie's Dream webinar series on our website. It will live there as well. So they can go back and watch it at any time. Oh, wait, there is one question that just came in. Hold on a moment. For the CDA, is it required that a senior facility person be included as a PI?
What the CDA is a Career Development Award for early career investigators, and I completely apologize for not including that slide. That's all on me. It's for early career investigators within 7 years of their terminal degree. That excludes time spent in medical residency or fellowship, and it also excludes time spent in family medical leave. You do have to have a career guide, which is not exactly a mentor because this is not a mentored position, but the career guide would help you through the wickets of, oh, how do I get into a tenure track position? They might actually give you more information about, contacting and networking, that kind of thing. The career guide would help be part of your application, but they're not the PI of the application. The PI of the application is the early career investigator.
Thank you, Donna. Donna, actually, I have another question. You briefly mentioned at the beginning of your presentation that there is a separate program for the rare cancers, and I know that is a whole webinar in itself. But is there anything that maybe you can just mention briefly to those who are on the webinar who may want to look at additional opportunities and how maybe stomach cancer fits into that rare cancer bucket?
Great. Yeah, that's an excellent question. The Rare Cancer Research Program started in FY20 with a $7.5 million appropriation. For FY21, its appropriation has gone up to $17.5 million, so quite a bit. And that's important because there's a lot of rare cancers out there. I think that people don't appreciate that. Rare cancers for the Rare Cancer Research Program are defined as 6 or less cases per 100,000. So that's what you have to look at. It's actually the same one that Europe uses and the American Cancer Society uses as a definition of rare cancers. Stomach cancer is considered a rare cancer, I believe. So it is one of the cancers that would be eligible for more funding under the Rare Cancer Research Program. So if for instance, you get funded by the Peer Review Cancer Research Program and you're still interested in getting more funding and you have another idea, you can always go into the Rare Cancer Research Program and submit there. The Rare Cancer Research Program is probably not going to be releasing program announcements for another couple of months for the fiscal year 21. I think they'll probably happen at the end of May, early June. So keep your eyes out for that. And I am not the program manager for that, but if you need, I can always get you in touch with the program manager there.
Thank you, Donna. And a follow-up to that, can a subtype of a cancer, so a subtype of stomach cancer, could that in itself be considered rare?
Well, I would say yes, because for instance, for melanoma, ocular or uveal melanoma is a very rare variant of melanoma, and it is accepted under the Rare Cancer Research Program. So yes, a very rare one of stomach cancer would be considered under the Rare Cancer Research Program as well.
Thank you. That's very helpful. Nicole, have any other questions come in?
Yes, this is, hi, Dr. Kimbark. I want to say thank you for supporting my work on stomach cancer. Your investment in stomach and esophageal cancer will change the landscape of the upper GI cancers research. My question is, can we apply, I think they meant to say, apply for funding while having a current DoD funding? Is there any, I think what they meant to say, is there any current DoD funding?
Yes, absolutely. You can apply as many times as you please, as long as there's not a restriction written in the program announcements, and as long as you're submitting different ideas. So you don't want to submit the same idea to different funding opportunities. So yeah, please do. If you're already supported, come on back.
It appears that there is, this is another question. It appears that there is new funding in the gastric cancer world. Can you please explain how that happens? So how they get more funding.
Sure. How
I
to
think
get
what
more
they mean
funding?
is how there's more funding, yeah. Mm-hmm.
Can you explain what you think it means? Because I'm not sure I understand.
I believe that they realize that there's already been money for stomach cancer. They want to know how, since there is more being allotted now, they want to know how that happens and why that happens.
I think that as far as how much money is being allotted for stomach cancer, I think a lot of it has to do with continuing outreach. One of the things that I really want to emphasize is the higher the receipt we get, the higher the chance that stomach cancer will have more funded in it for each fiscal year. And plus, PRCRP has more money and more opportunities to fund more things for all of the different cancers. So that's really how it happens. There's not one specific, reason, but it's a multitude of different types of reasons and different people really pushing for it, I think.
The person says, thank you very much. And I think that's all I see at the moment. Unless anyone else has any questions, we can leave it for just a second.
Thank you so much, Donna, again, for that excellent presentation. We really appreciate your taking the time, and thank you to everyone who joined today's webinar and for your questions. Like Donna said, ready, set, go. Look for that look for the announcement next week. Get your applications ready, and thank you so much for joining us today.
Thank you again, Donna.
Thank you. Thank you.